the Osteopathic Center. Just had a couple thoughts about sharing about what we actually do here and all the different types of injections that we have to offer. So we mix a traditional orthopedic practice with regenerative medicine and a little bit of integrative medicine as well. So depending on exactly what your injury is or you're trying to treat, we can kind of hone in and give you a menu, so to speak. So I'm going to go through, I wrote down a list because they're hard to remember all the different options, but just to give you an idea of say you have a shoulder injury or a knee injury, or you're treating rotator cuff injury, or you're treating arthritis. We have different options depending on how aggressive you want to be, how much pain you want to be in after the injection, how aggressive in terms of how many cells you're trying to put in there, or if you just want to numb it up and kick the can down the road, so to speak. So when it comes to traditional orthopedics, that's usually where you talk about Lidocaine Shot, which is just a temporary block, steroid shot, which can calm down inflammation. Traditionally, it doesn't last a long time, but it can help, at least temporarily. There's a long-acting version, traditionally only used for the knee, called Zilretta. Then you start talking about more your gel injections, your hyaluronic injections, and all of those main three are, for the most part, covered by insurance. After you go from there onto some of the integrative and more regenerative medicine options, and those are where you start getting out of network and no longer covered by insurance, unfortunately. So you have your natural stuff, which is something like Tramio, which is a homeopathic version of a inflammatory. It's almost like a homemade generic version of a steroid, kind of, the easiest way to put it. Then we have something specifically for arthritis called Zeal that you can inject. Then you have Ozone. Ozone is traditionally used for a bunch of different things. You can clean or filter the blood with it. You can also form it into a gas and inject it into a tissue or a joint. And it's actually 3 oxygen molecules combined. And it helps to reoxygenate the tissue, heal some of the tissue, and also clean some of the areas. Then we start going from there, traditional, what we call Prolotherapy, which is using sugar water, 5% dextrose, and you use a needle to kind of irritate the local tissue, drop some of the, inject some of the lidocaine as well as the Prolo in there, and that helps to help recruit some tissues and some blood flow. Then from there, you're starting to get into your traditional regenerative medicine things. So we have, you've probably heard of PRP, or platelet-rich plasma. That's where we take blood out of your arm and get the platelet cells from it, and all the different, and the plasma and all the different good qualities from there. The next step after that, which has much higher cell lines, is taking your bone marrow out of your body. That would be bone marrow aspirate concentrate. The next level after that would be taking fat cells traditionally out of your abdomen, stripping them down, and then injecting them into a joint. And then you start talking about the different types of cells that you can get from other people or that are man-made. So that's where we start getting into stem cell. So you got a couple different types of stem cell, one of which is from amniotic fluid. Then you have amniotic tissue, which is a tissue grafting agent, almost as if you were trying to give like plywood to someone building a house. You're basically giving them the plywood to allow them to get the ingredients to fix what you're trying to treat. The next or different level after that would be umbilical, which is usually taken from something called Wharton's jelly inside of the umbilical cord. That has a different type of cells than the amniotic. And then finally, we have something called exosomes. Exosomes are like the new cool thing, and they're man-made. They take the really beneficial part of the cell and they multiply it millions of times, and then you have that concentrate in a cell, and you can inject that into whatever you're trying to treat. So those are all the different types of regenerative medicine and traditional things that you can technically put into a joint. So as you can see, it's not easy. It depends on what your activities are, what you're trying to accomplish, what level of pain you're comfortable with, living with, and how aggressive you want to be in treatment, and unfortunately budget as well. So thank you for tuning in, and we'll be happy to take care of you whenever you stop by or have any questions. Thank you.